Hello and welcome to another edition of the RIMAT Video Edification Series. In this edition, we'll talk about the Zika virus, a future memory, and a current serious problem. First, let's consider what is Zika. Zika fever, also known as Zika virus and also Zika, is an infectious disease caused by the Zika viruses. Most cases are symptom-free, but when they are present, they're mild and can resemble dengue fever. These symptoms can be red eyes, joint pain, headache, and a mild fever, and also a rash. These symptoms last less than 7 days, and the symptoms have not caused any deaths during initial infection. The big problem is during pregnancy, which can cause microencephaly and other brain malformations in some babies. Infection in adults has also been linked to Guillain-Barré syndrome. As of mid-2016, a widespread epidemic of Zika fever caused by the Zika virus is ongoing in the Americas and the Pacific. The virus is spread mainly by the Aedes aegypti mosquito, which is commonly found throughout the tropical and subtropical Americas. It can also be spread by the Aedes albopictus, or Asian tiger mosquito, which is distributed as far north as the Great Lakes region in North America. Confirmed cases have been reported in 40 countries or territories in South America, North America, and the Caribbean, as well as 16 countries in the Western Pacific and one in Africa since the beginning of 2015. Many countries with no cases of mosquito transmission have reported travel-related cases, people who moved or came home from a Zika-affected region before they showed their symptoms. Now, how is Zika transmitted? Zika can be transmitted from a mosquito bite, a blood transfusion, or a sexual contact. The most serious situation of transmission is with regard to a pregnant woman. The pregnant woman can acquire Zika from the mosquito or sexual transmission or blood infusion, and the subsequent fetus can come down with microcephaly, which is a severe birth defect, including below average head size, and has caused stillbirth and severe handicaps in the newborn. Transmission is via the bite of mosquitoes from the Aedes genus, and sexual transmission is from men to women and from women to men, who have both, and both of these have been documented. A pregnant woman can pass Zika to her fetus. The Zika virus can be passed from a pregnant woman to her fetus during pregnancy or at delivery. The symptoms, as we mentioned, are conjunctivitis, a mild fever, headache, or skin rash or joint pain. There is currently no specific treatment for the Zika virus infection. Care is supportive with treatment of pain, fever, and itching. Treatment is for the symptoms, and they can be treated with common pain and fever medicines, rest, and plenty of water, although it is recommended not to take aspirin or NSAIDs while sick with Zika. The major concern of Zika is, of course, with respect to birth defects. A proven causal relationship between Zika and these serious birth defects are the Zika infection during critical periods of early pregnancy, specific rare patterns of birth defects in fetuses or infants with presumed or confirmed congenital Zika infection, biological evidence, including the presence of Zika in the brain tissue of fetuses and babies with severe microencephaly who had died. rare exposure to the virus, and a rare birth defect. Zika can be prevented if one would cover their skin with long-sleeve clothing or trousers, or sleeping with mosquito nets, eliminating containers that hold standing water to prevent mosquito breeding, using insect repellents, and also using screens or mosquito nets in windows and doors to reduce mosquitoes entering the home or office or what have you. The Zika virus. Will this be a future memory? The Zika virus epidemic is likely to run its course within the next 18 months, according to a study by researchers in the UK and the US. There's a reference here below if you'd like to do some further reading. The findings suggest the current epidemic is likely to last for 3 years in total. The 3 years counts for the transmission we have seen so far, and we have seen at least a year of very high levels of transmission. So we're probably coming to about the halfway point of this epidemic. Further large-scale epidemics are unlikely to occur for at least 10 years because a large proportion of the population will be immune to the virus in the wake of the current epidemic. That offers protection via what's called herd immunity, where there are too few people susceptible to the virus for the disease to spread. The only way that can change is by new people who are not immune entering the population. And the way that has to happen is through births. Basically, an entire generation need to be born before you get a high enough fraction of the population not immune to sustain transmission at epidemic levels. And below are some references should you like to read further, and please feel free to download this presentation for your own edification. If you should have any comments, questions, or concerns, please contact myself, Stuart Silverman, at the email below or at the phone number listed below. I thank you for your attention, and I hope to bring you more installments of this series soon.